How did the approaches that you're recommending take into account physicians and other providers of color or who work in poor communities where services are very limited and the patients are sicker with many comorbidities, especially when we're focusing a lot on outcomes? How do we take into account where that patient started from? And when we're talking about evidence-based medicine, when many people of color and sometimes people with other comorbidities are not in the clinical trials that produce that evidence?
Well, I guess what I would say is our philosophy is, I mean, the term that's been used up here is one size doesn't fit all. We really in the Blues believe you have to meet the physician's practices where they are. And you can't take a cookbook approach across the country and say it worked here, therefore it will work everywhere. And you have to work with the local physician communities and the local provider communities and develop a program that starts from where they are and provides incentives, information, and data to help them move the needle forward so that from wherever they're starting from, you pay and you reimburse for improvements from where they are, not measures against some mythical standard that exists on a global basis. So we really believe that the closer you get to local management, the better the outcomes and the better results you're going to get from patient-centered medical homes. So that's the way we deal with those issues in all cases.
Dr. Nash?
Yeah, CDPHP is our region's largest provider of managed Medicaid services. And we partner very closely with our federally qualified health centers and other private providers with large Medicaid populations. We support them not only by paying them more comprehensively, as I've been describing this morning, which allow them to sort of deploy those resources as they see fit for those patients, but we deploy our own resources, and that is we've created community health workers to work in the communities to go outreach the patients, to bring them into the doctors who aren't being seen, as well as putting pharmacists and behavioral health workers in those practices.